This is Tom Biernacki, and if you're watching this video, you probably have a stubborn wart that is not going away. 90% of the time, they go away pretty predictably, but sometimes they are difficult. You try all the home remedies, you try all the home treatments, nothing's working. So what do? We're gonna go over the new research, the new science, and what I would do personally for my patients, and we're starting now. The number one thing is with stubborn warts, people need to confirm the proper diagnosis. The plantar wart is an HPV virus. This is a virus that can get in through cracks of the skin. Sometimes people have repetitive biomechanical traumas. We're talking significant corns, calluses, splitting cracks, and this is actually very common. I have patients that do have genetic issues or on immune blockers, for example, like a kidney transplant. I just had a patient with warts all over the place, but it was still a biomechanical issue. He was really leaning into the front of his right foot. He was ripping his skin, and viral particles and bacteria just kept getting in there. It kept forming weird skin, thick, scaly skin, but we got the pressure off of it. We trimmed and cleaned the skin with the proper topical medications, and it cleared right up after he's seen like 3-4 general doctors that were treating it just like a wart. So that's one example. Frequently, I see these misdiagnosed, even when it's like across the whole front of your skin. And now with diabetes, with weight gain, with high sugar diets, skin problems are going through the roof. I have a guide, my top 16-foot skin conditions, my top 25 diabetic skin conditions. I go over how to diagnose those, what to look for, the pros, the cons of certain treatments, the diagnoses. Check that out. Here we're focusing on the wart, which is the HPV. So I'm going to assume that it was properly diagnosed. What I would do is I go over who's treated this before, what have you used, how long have you had this wart and treated it? What's your pain level? How aggressive do we need to be? And on physical examination, you actually want to look at the wart. The wart itself will have little black spots and there will be skin disruption. The wart is a foreign invader. It's essentially like a flower that grows in your skin that is a foreign invader. It's a virus. And what happens is there's none of your own nerves. It's like a rock or a pebble stuck into your skin. And that's kind of where it differs from a callus. That viral particle can frequently come in through cracks, repeated trauma. Are you in moist environments like shower room floors, swimming pools, locker rooms? Do you have those grainy, fleshy growths? Do you have those black pinpoint wart seeds that are actually clotted vessels? But corns and calluses, these are actually plugged sweat glands, and calluses are thick skin. That's actually part of your skin. And these are more biomechanical issues. They overlap quite a bit with wart. This is where a lot of people get it wrong. And when I see them, they're not even treating the right issue. But you have calluses, corns, and warts. They all look a little bit different. So the difference here is that calluses are wide and flat, corns are pinpoint and hard, and warts are actually an HPV virus. They all start with friction and damage. The wart squeezes in, but you can see the wart actually steals blood vessels, but not nerves, and it has those pinpoint blood vessels. A callus is wide and flat, and a corn is pinpoint hard, like a pebble, and it stabs into the skin. They all are treated similarly, but differently at the same time. And another thing, you could also have athlete's foot or fungal infections or bacterial infections. So as you get this thick, dry skin, it's actually a thick exterior layer of dead cells that fungus and bacteria can live on. And that can look like a wart for a lot of people. So I've seen a lot of that. And the problem is you can use all the right medications, the right treatments that we're going to talk about, but they will not penetrate through that thick skin and won't stop this issue. The first line treatment is we have to break down that thick, dry skin, that callus that's protecting the wart. This is the number one problem that most people have. As a podiatrist, the easiest thing I do is I use a scalpel to trim off the top of the skin. You can see, do you have that pinpoint bleeding? Is it actually a wart? A lot of the times people aren't able to do this effectively in the house. They're not able to see that, but there are salicylic acid preparations. There are topical keratolytics such as urea cream. There's 20%, there's 40%, there's 12% urea cream. There's also duct tape. Duct tape can be applied on top of this wart or dry skin. You can see, do you see that pinpoint bleeding after a day or two? Another easy option to get pressure off there is an orthotic, good shoes. You can use a pumice stone. You can soak your feet. So vinegar, Listerine soaks. I go over all my skin exfoliating remedies down below. These can work really well. The British Journal of Dermatology found salicylic acid is really good at exfoliating the skin that can go on top of the wart. So a lot of times to see that pinpoint bleeding, that fleshy granule, you want to make sure that it truly is a wart. And you can keep applying this daily. Another great home option at this point is cryotherapy. So when you go to the corner store or your grocery store, the liquid cryotherapy kits are available now. And the Journal of American Academy of Dermatology showed that this is an effective treatment. If you apply it once every 2 to 3 weeks, it requires several sessions, but it can thin that skin down. You can also combine cryotherapy with salicylic acid. So I like both cryotherapy and salicylic acid. Cryotherapy is the freezing, salicylic acid damages the area and it stimulates your body to attack that wart. The rationale is that combining the physical and chemical methods will enhance your body's stimulation. There's also laser therapy. One thing that I love to use in the office between acids and cryotherapy is beyond just scooping out the top of that wart, but you can hit it with the laser, you can hit it with the cryotherapy, you can hit it with the acid. At that point, your body will start to handle it 95+% of cases that I see. There is research showing variable success with a lot of lasers. There's different lasers. The one I use, it's painless. It's pretty safe, especially for kids, for adults. I've had really good results. It's kind of my go-to. There's not a lot of issues. Combining it with different methods gets even better results and it avoids scarring, it avoids tissue damage in that regard. If those physical methods are not doing it, that's when you have to consider the more advanced interventions like immunotherapy. And I'm gonna be honest, I never have to even consider these because it works 99% of the time for me. Combining the methods that I talked about below, potentially you might have to numb up the skin and get more aggressive, but you can scoop out most of that wart. And if you stage it in a row, it gets extremely good results. But there are immunotherapy agents like Candida antigen, mumps antigen, interferon, imiquid. Injecting these agents stimulates the body's immune system to fight the wart. This is studied in the Journal of Drugs and Dermatology. It demonstrated the effectiveness of these interlesional immunotherapy agents for treatment-resistant warts. These injections may be painful and may cause local reactions. Another option is Bleomycin. This is an anti-cancer drug. Treating warts is an off-label use. It works by inhibiting DNA synthesis in the wart cells. A study in the Dermatology Surgery Journal showed high efficacy in treating resistant warts. This shows a risk of pain, nail problems, and should be avoided in anybody who's high risk. But the reality is, again, I've never even had to get to this point. I really like laser as my last line therapy. These lasers work by destroying the wart tissue. It uses different wavelengths of light, and there are a lot of great studies. The Journal of American Academy of Dermatology found laser to be extremely effective for warts with minimal side effects. And I found that to be true. There's no pain, no issues. The reality is, I guess I can't speak for everybody, but if you're in Michigan, you come see me, we'll figure out a way to get done. Technically, these are cash pay, but the reality is if you're a suffering kid, if you're someone who's had problems, we will figure it out. Just come see us. There's a lot of great doctors who will help you out in the area. And I have to kind of bite my tongue with, unfortunately, the insurance game and the business side of medicine, but we will figure it out. The laser in my go-to is my kind of end line therapy if the early stuff does not work. It's just so easy. It's so effective. But if all that doesn't work, surgical excision. Realistically, all these treatments will shrink it down. What I do basically, we shrink it down as much as possible. We address your health concerns as much as possible. We get the proper shoes, the proper orthotics to get pressure off of it. And then you use some topical numbing medication, some lidocaine, an injection potentially, and you can scoop the whole wart out. At this point, it's probably shrunk down quite a bit. The beauty is your wart does not have nerves inside of it. The nerves are around it. So it's kind of like a pebble in your skin, but you can scoop out the center of it. And the reality is, with a Band-Aid or the proper padding, you can go right back to walking. You can go to work, you can go to school, and I treat that like once a month until it disappears. It almost always disappears. Now, if you're a kid Or if you're someone who's coming in for the first time with a wart and you've got a huge patch of warts, I'm not going to scoop that whole thing out. You're going to be missing all that skin. That's a terrible idea. You want to do the other treatments I talked about to shrink it down as much as possible until it's practical. Just wipe out the root with surgery. Surgery is the last resort. When the wart's small and it's frustrating taking a long time, it's just so straightforward and easy. I don't do it in the operating room anymore. I've seen kids and stuff when I was a resident get this done. They've had a long time healing. I think that's a slower process where you just shrink that wart as much as possible before you get rid of it, because it can cause some scarring. It can cause problems. Now, the trick is there's more complicated issues sometimes. If you have an immune issue, if you had a kidney transplant, for example, and you're on immune blockers, I'm going to have to work with your doctors managing those medications to see how we can address it. That's a different problem. If your immune system's not working, we have to get your immune system working. And those are that 1% of cases that potentially are not working, where somebody might be on blood thinners, somebody might be on cancer therapy and immune therapy. And at that point, how aggressive do you want to be to treat your wart? I don't think that's the time to be very aggressive. That could potentially create risks. There are a ton of experimental clinical trials with newer therapies, but the reality is, I think in a practical consideration, what's the point? This stuff works. If you slowly shrink that stuff down, address it biomechanically, address your health issues, and then eventually combine the acids, the cryotherapy, the physical debridement and offloading, and then eventually the laser therapy. That's a safe, easy way to do it. And then surgical therapy. And when I say surgery, I mean procedures in the office that take care of it. And I would love to actually show these videos. Unfortunately, they get demonetized immediately by YouTube, and it kind of lowers the ranking and then nobody sees the videos. I got to get in touch with guys like Tobro and see how they're doing it, because it's not working for me. I don't know why, but the big secrets are this. You have to set a plan. These warts take a long time. You want to shrink them, then eventually scoop them out. It should be done painlessly and effectively. I like acid. I like cryotherapy. I like to diagnose it correctly, and I like to use the laser. I can do all that in the office. And then number 2, great biomechanical exam. See why there's so much pressure on the front of the foot, the heel, the fingers, whatever. What's the repetitive issue? Address it. And that for me works just about every single time. Tell me if I'm missing anything. Tell me if you have any problems, and we can make further videos if I'm missing anything.